Hi there, and welcome to bodyworksbyjoel.com. If you're following me on YouTube, then well, obviously you found me through my first and last name, Joel Gilchrist. What I'm going to be showing you here today is a neck protocol, very simple, for you all at home to do, as long as you have permission by your medical doctor, physician, chiropractor, or osteopathic doctor, any qualified doctor that says, yes, you can do this at home, it's good for your neck, it's good for your migraines and headaches, because this specific protocol has been proven, based on my personal experience, to give everyone that I've worked on complete relief from headaches and migraines. Now, you might feel a little dizzy afterwards, maybe because you were not getting enough sleep or too many toxins being released. But please, if you're not a licensed practitioner performing this on a patient, then go ahead and make sure that you get your approval by your doctor. If not, feel free to give me a call directly. My number is 480-381-5779, and you can find that on my website. But enough said, let's go ahead and work on the scalenes. Now the patient has her neck turned to the right. What we're doing is working on the left side, anterior side, also known as the front of the neck. Now we are looking to warm up the attachments first, and that's going to be underneath the collarbone. Breathe and relax as much as you can. And relax your back. You're welcome to bend your knees too. Sometimes people who find, let's say if you haven't had a massage in a while, they'll find that the rest of the body will respond to the release going on. So you might get a cramp in your back, in your feet, and those things you want to become aware of, because that could be nutritional, that could be hydration, or that could be something more. So you do want to be careful about this area right here. This area is full of lymph nodes, and this whole shoulder girdle is called the brachial plexus. And we're looking at nerves here, nerves underneath the arm, nerves that cause numbness and tingling and even organ dysfunction in the heart and in the lungs. So please, again, I can't stress the importance of talking to your doctor or licensed practitioner to get better advice on how to do this on yourself at home. Well, I'm going to go ahead and start with two fingers. Actually with her we're just going to do one. We're going to massage underneath the clavicle, okay, where those scalene muscles attach to. These scalene muscles attach to the first rib, at times underneath the clavicle tissue, the connective tissue there, as well as sometimes the second rib. Good, good. I always promote breathing with my patients because one, it reminds me to breathe, and two, it reminds them to breathe. Okay, so I'm just warming up the area. You can do this however you like. I mean, the attachments of these muscles are right here, and you can actually feel them like ropes. Like I feel a rope here, and a rope here, and a rope here. That's a muscle tension, pulling your neck forward, pulling it down, and possibly causing an imbalance from the front and back or the left and right side. This obviously being the left side. So now, after warming up underneath the clavicle, I'm going to start out at the furthest point, right before a muscle called the trapezius. The trapezius also attaches over the top of this area to the clavicle, that 1/3 of the clavicle right there. So I just want to work into this musculature and push up. I'm using gentle pressure. Again, I don't want to aggravate any of the nerves going down into the heart, into the lungs, or into the fingers. I don't want to cause any muscle spasm on the other side. I don't want to stop blood flow at all. I just want to promote healthy release of toxins, healthy release of tension and stress. So I'm following these muscles up towards the ear. You see the angle that I'm going at? And I'm not going completely up towards the ear or even to the back of the skull, because there's actually a small bone here that if you break, you can have a lot of difficulties. One of those difficulties is tinnitus. You can have tinnitus for 3 months, and that's ringing in the ears. It's very absurd, very crazy. And that small bone, it hooks on like a tooth or even a claw underneath the back of our ear. Is pretty amazing. Just that small pain and discomfort can cause a lot of disorders. All right. So I'm massaging up towards the attachment. So the beginning attachment is underneath the clavicle to the first and second rib. The ending attachment is at C6. C5, C4, C3, C2 way up in there, which I can't really get a hold of, okay, because we don't want to push too hard in this area, and then to the back of the skull. There we go. Again, pulling, and if you want to visualize, we're just pushing this tissue away from this tissue. Real simple stuff. Real massage therapy 101, so to speak. Now, if you have any major issues, it's always good to go back and look at my trigger point video. It teaches you how to appropriately apply pressure until there's relief to help finish this protocol. And any protocol that I do, I like to involve that knot releasing protocol. So I'll push here because I know there's a knot here. I can feel that. You feel that right there? Okay, you're breathing nice and deep. Good, good. Now, if you're doing this on yourself, it's thumb across and underneath the clavicle. Find that tissue. If you're not able to find your clavicle, don't do this. There is much more going on than just muscle tension in this area. Sometimes muscle tissue will accumulate so much that the clavicle almost seems flush, if not buried, within the swelling and inflammation of muscle tissue. Is that still hurting? Good, good. You know, you can, yeah. There we go. So that's going to be the neck protocol. It's always nice to do a little bit in the back here, just pushing down along the trapezius, and you can feel the difference between that muscle tissue that's in the back or posterior and that's in the front. See, feel that roll right into the back of the neck. It's all connected. Remember, it's all connected. So feel free again to give me a call. Find me on my website, www.bodyworksbyjoel.com. I appreciate you listening and tuning in for those of you who are just online. And you know, if you have any questions, I look forward to answering them in the future. Have a great day. Bye-bye.